Today, many people found themselves victims of the rampaging insurance companies, causing widespread financial problems for low-income families stemming from a simple, basic human need simply to attain proper health and well-being. Throughout modern American history, there have been many attempts at mending this issue by attempting to create a nationalized healthcare system run by the United States federal government. Even as far back as World War II, as the war neared its climax in 1944, the sickly Franklin D. Roosevelt proposed a second Bill of Rights to the public delivered through the airwaves of the war-weary nation. And in his speech, one of these groundbreaking proposals was the right to adequate medical care and the opportunity to achieve and enjoy good health. Unfortunately, this bill never came into being and was forgotten in FDR's tragic death just 1 year later. And while his second Bill of Rights was a general statement on the matter of the issue, it was an important undertaking and a strong initial step that would lead to numerous arguments and frequent debates on the important topic of what would become the proposal of a nationalized healthcare industry. Today, this controversial topic has once again found its way onto Capitol Hill, where it has found both strong support and opposition. But this time, it could prove to weather the political storm and survive as a helpful and resourceful arm of the United States federal government for the American people. Currently, there is much confusion regarding specific information of the workings of healthcare. As of today, all healthcare is paid for by United States citizens. This is done either with private spending directly to hospitals with their own money or through premiums via insurance companies, or more indirectly by public spending, a common method where tax revenues are used on the national, statewide, and local level to pay for Medicare and Medicaid. While these two facilities are a start, they simply are not effective enough to tackle the needs of the American population as a whole. It has also been observed that in these past 10 years, healthcare premiums have been growing at a rate twice of that of workers' wages and inflation rates. Presently today, 47 million Americans are uninsured, and with these rising healthcare costs, the number is sure to increase. In fact, many American citizens who do own health insurance are still caught in a financial trap, while even though they're covered, they cannot afford the copays that they must provide in the event of the necessity for the intervention of medical care. But one might ask, what is the reason for these high costs? The cause is due to the lack of competition, technological complexity, and the customers themselves. With these factors, private insurance companies have essentially a free rein over the prices they charge for their services and the extent of a beneficiary's coverage. In some cases, coverage has been slashed to such a small amount that it can barely be considered coverage at all. Unfortunately, victims of this kind of greed often keep their insurance and take what they can get, all in hopes of reserving some kind of coverage regardless of the cost. And with these tough times, unemployment has skyrocketed, meaning that even more people are losing their health insurance as a result of no employer medical plan. In addition, if the unemployed person were to obtain a job, the company's insurer has the jurisdiction to deny the new employee coverage if they have a pre-existing medical condition. In fact, the United States has the highest cost per capita for health insurance of any industrial nation in the world. As a result, the main cause of bankruptcies in the U.S. are because of these gross healthcare costs, and simply enough, the inability for these beneficiaries to pay. Is the system not flawed enough? At this point, change is necessary. In light of all these downsides to the U.S.'s current condition on the matter of healthcare, a proposal has been made to reform the health industry for the first time since 1993. The proposition from Congress, if successful, would provide near-universal coverage to those who are currently uninsured and would, if not reduce, bar the growing costs of private health insurance companies today by adding much-needed competition in the healthcare market and forcing insurance companies to adjust their policies and prices in order to remain an active candidate for potential customers. This would be achieved because the introduced government-run healthcare would have significantly lower costs and yet still offer equivalent or near-equivalent coverage to the current withstanding cost-to-coverage ratios offered by current private companies, while coverage would be allotted to those with a pre-existing medical condition. Through cause and effect of the U.S.'s basic principle of capitalism, those who are already insured will be alleviated of the constant increase in medical prices that have plagued the United States for years. Finally, the market for healthcare would be more competitive and be more beneficial to the customers because the financially feasible introduced policy would undoubtedly cause many individuals to flock to the insurance company that provides more reasonable prices for the consumer, causing private companies with fleeting members to improve and reform their quality of service, prices, and extent of coverage to successfully compete with the newly introduced national system. There may be a hope yet. Of course, there is also opposition to this newborn clause. Opponents of the nationalized option frequently voice their belief that increased government influence in healthcare would lead to the creation of death panels to decide on the life of the patient based on their level of productivity in society, and will put end-of-life insurance in the hands of the patient. While the latter is true, the rest is entirely false. In refute, the proposed healthcare certainly wouldn't lead to euthanasia, as the bill never stated there would be discrimination based on a person's level of productivity. All patients will be treated with the same level of care and service as any other individual, and for the other, putting end-of-life care in the hands of the patient would actually be beneficial to their health, which is one of the things that current healthcare reform promotes. As of today, many people receive painful, expensive, and many times useless treatment in their last 60 days of life because medical administrators decide what to do if patients are not in a capacity to make decisions for themselves, which is currently decided based on the often mistaken discretion of their physicians. In addition, there are also those that voice that the government option would result in a complete takeover of the healthcare industry. This is a contradictory statement since the word option is clearly stated in the phrase. The federal healthcare would be a competitive business that would run parallel with the others, quite similar to how the Postal Service competes with private companies in shipping and mailing. In other words, the public option would be on a level playing field with current standing companies. It would be self-sufficient to either leave the federal deficit relatively unharmed or even provide such a profit as to create revenues that could be used to abate the insurmountable debt accumulated by the United States over these past years. All in all, the primary reason among the opposing parties seems to stem from the beliefs of congressional members and leaders worrying of a loss of individual economic prosperity and clouded beliefs that often end claiming that the United States will become a socialist bastion from government intervention. There have also been reports of comparing the proposed healthcare bill to that of England or Canada. This is not accurate, as both are completely nationalized. It is true, however, that both foreign populaces enjoy cheap or no costs, universal coverage, and a healthy general population. This is what the opposing factions desire, with the belief that it can be done solely through private industries at their discretion. However, by the examples shown through the rather recent banking collapse, this is not a plausible option. Currently in several states throughout the United States, health fairs are held whereupon thousands and thousands of citizens gather in order to receive basic checkups and immunizations from volunteer doctors, nurses, and charitable organizations willing to spend their precious time and resources to help those in need. While many who show no insurance at all, there is also a staggering amount of people that attend who are in fact insured but cannot afford the medical copays. People who wait in lines hundreds deep for hours on end to receive even basic medical necessities that they cannot afford due to the currently flawed system that has remained because of fears of presumed death panels, potential monopolies, and the dumbfounded belief of socialist regimes. The United States is the only leading country in the world that makes such profound profits from the illnesses, diseases, and physical misfortunes of others. This is why it is imperative to be able to determine the fact from fiction and to detect faults and fallacies in the sensitive subject of national health care. This is why it is an utmost importance on your part as an American to know why reform is such a current necessity for so many. Would you prolong the suffering of the sickly member of an American family? Support healthcare reform today, and perhaps tomorrow all Americans, all U.S. citizens will be free from the fear of being able to attain adequate medical care and the opportunity to achieve and enjoy good health.